The healthcare course at the GSB that I found the most engaging and compelling was the course in healthcare strategy and the landscape of healthcare taught by Robert Pearl, who is the CEO of Kaiser Permanente Group. So just having such an authoritative and credible figure in of itself is such a privilege, with such high-level insights into the healthcare industry. And that course specifically was really mind-blowing because spending 10 minutes with Robert Pearl talking about healthcare was more insightful than the hours I had spent reading about it online or discussing it with other people, because he just was able to so crisply communicate the high-level picture and the concepts and the mired incentives and the landscape of the different players in such an accessible way. It was really refreshing and taught me how to think about the entire industry in a very different, easy to grasp way. Professor
Chess both teaches a healthcare class that focuses on the current state of healthcare, and he also teaches an entrepreneurship class that's a more general entrepreneurship class, but he brings in a lot of healthcare cases. And I've just really enjoyed having him as a professor because he's both very funny, but he can also really lead a conversation with 60 people. And he just knows so much about the industry and how things work. And his network at the same time with all the alumni that have gone through his classes is amazing. So just kind of his sense of humor and his availability and just him as a person too, somebody that really cares about his students as individuals, has been really wonderful.
So as a business student, you're able to take courses across the street, which is a phrase for courses from schools other than the business school. And being a previous medical practitioner, I was very interested to go and see what was happening over at the medical school, and I was able to take courses in pharmacogenomics, bioinformatics, and translational science over at the medical school with some terrific professors there. And that's been a really terrific way for me to kind of broaden my perspective on what's happening in healthcare more broadly.
So I took a number of courses across the street, both in the economics department in global health and at the medical school, which were really useful and provided different perspectives.
So Design for Service Innovation is another course that is prototypically a Stanford kind of course because it brought together such a diverse set of teammates, from engineers to medical students to business school students to PhDs to law school students, to work together to bring their different perspectives and apply them towards a common problem or solution, focused on solving a design need rather than arbitrarily inventing something based on something you presume to be the case, but rather diving into the design mode of thinking and asking real users, real people in need with healthcare conditions, and asking them what complicates their life, how can we make it better, and then using the diversity of our minds and perspectives to actually think of a solution for them. So that course was a really refreshing immersion into what Stanford is all about, which is bringing together all these different perspectives and skills and actually applying them for positive social impact.
Another class that I really appreciated here was the biodesign class. It was just amazing the amount of support and resources that are provided through the class. It's more than just a class, it's almost like joining a network or getting a certificate or being a part of something much bigger. At every class section, they bring in sort of consultants and experts in the field to mentor you on an individual and team basis. You're paired off in teams, and on your team you'll be with engineers and med students, and it's just an amazing sort of interpersonal dynamics, exposure to kind of work on these teams. You're working on real problems. We've submitted patents, we have prototypes. We're just getting ready, actually, I'm in the class right now, to submit to a panel of VCs and consider moving forward with our project, so even after graduation. So it's been just an awesome experience.
And I've just been so impressed about, in general, the availability of the professors here. They're always willing to talk about your career and connect you with somebody, some alumni that kind of does something you were interested in, or another professional that they know that they're in touch with. They're always just willing to talk, which has been really impressive and amazing and good.